One of the common questions asked to me in the clinic is, Doctor, what kind of food we can give to the child during the fever? So what happens is, during the fever, child's appetite reduces and child become fussy because of the reaction of the fever in the body, and parents become anxious because we all know that during the fever child needs a lot of calories to fight the infection. So first thing I tell the parents is, you give small amount of frequent feeds to the baby, because during the fever child will not eat large amount of food or normal portion. So another important thing is, you give semi-solid food which is easily digestible. For example, you can give rice dal khichdi or dalia khichdi. Khichdi is a complete nutrition and it is very rich in calories and easily digestible. You can even increase the calorie value of the khichdi by adding some butter and ghee into the khichdi. Other food which you can give during the fever is, you can give rice curd mixture, or you can give rice potato mixture, which are again rich in calories, easily digestible. Other options are fruit juices or fruit puree. Fruits are rich in carbohydrates and very easily digestible, and sometimes the fruit taste is sweet, so children like the fruits. Apart from that, you can give vegetable puree. Vegetable puree also are a very good source of nutrition, and it is very helpful in recovering from fever. Warm soups actually soothe the throat and help the child feel better. Apart from all these things, one more important thing you should remember is, give adequate amount of hydration to the child during fever, because during the fever lot of water is lost from the body in the form of sweating. So we need to give simple water, coconut water, rice water, dal water or lemon water to keep the child hydrated. So if you follow all these steps and take the medicine prescribed by your doctor, your child will make a very fast recovery to normal health. I hope you like this video. If you want to know about any other child health care topic, please ask in the comment section. Thank you.